Chris Lieu, GI medical oncologist from the University of Colorado. So who should be screened for hepatocellular carcinoma, and what tests are typically done to screen for this? So hepatocellular carcinoma, we also call this HCC, we also call this liver cancer. It's the most common type of primary liver cancer, or in other words, a cancer that begins and starts in the liver. Liver cancer incidence, when you look at it, has actually tripled since 1980. But we're actually hopeful that as patients are given more effective treatments to eradicate hepatitis C, and of course, knowledge and prevention of some of the risk factors for liver cancer, we're hoping to see the incidence of liver cancer decrease not only in the United States, but of course, worldwide as well. The risk factors for liver cancer include anything that causes long-term inflammation and scarring in the liver, and we call this cirrhosis. And some of the things that commonly do this can be a virus like hepatitis B or hepatitis C. Certainly diet plays a role into this, and of course, heavy alcohol can be really hard on the liver and also cause liver cirrhosis. Approximately 70% of the cases of liver cancer in the United States could actually potentially be prevented through the elimination of risk factors like obesity, type 2 diabetes, hepatitis, just reducing alcohol intake. And of course, smoking would reduce the risk of, or not smoking would reduce the risk of many cancers. Interestingly, some evidence actually suggests that drinking coffee may actually reduce your risk for liver cancer. So you can keep that in mind during your next trip to Starbucks. There's no actual screening program for liver cancer in patients that are not at high risk for the disease. However, patients that are at risk for liver cancer should undergo regular and routine screening. We talked about some of the risk factors for liver cancer, but it's essentially anything that causes liver cirrhosis, which is that hardening of the liver due to chronic inflammation. This is oftentimes, again, caused by viruses, but can also be caused by other infections, alcohol intake, or even just fatty liver disease. For patients that are at high risk for liver cancer where surveillance is recommended, we suggest abdominal ultrasound. So where they take an ultrasound probe and just place it over the liver, and that is the primary tool used for screening. Abdominal ultrasound performed for liver cancer surveillance is usually focused only on the liver, and sometimes the ultrasound technician may take a look at the spleen as well. An ultrasound is a good screening test. It's non-invasive, it's fairly quick, and of course, there's no associated radiation with the ultrasound, making it a very safe test as well. For high-risk patients who require liver cancer surveillance, the abdominal ultrasound is usually performed every 6 months. There are a certain number of patients where the ultrasound is technically suboptimal, and what I mean by that is that they just aren't getting a great picture of the liver. And that can be for numerous reasons. And so in that situation, other modalities such as a CT scan or an MRI with contrast can be used to routinely evaluate the liver. Sometimes physicians will also use a blood test. That's where they draw your blood and they look for a protein called alpha-fetoprotein. This is also called AFP, and we can use this test to help screen and detect for liver cancer. And really what the doctors are looking at is the trend of the AFP. Is it stable? Is it normal? Or is it going up and consistently going up? If a concerning area is seen on liver ultrasound, some additional testing may be warranted. So if there's an area of concern that's actually less than 1 centimeter, which is pretty small, you can continue to monitor that area every 3 to 6 months for up to 2 years. If that area disappears or gets smaller, then the patient just returns back to 6-month interval ultrasounds. If a tumor is larger than 1 centimeter, or if an area is growing, physicians will oftentimes order some additional imaging. And this is usually a CT scan with contrast or an MRI with contrast. It's really important to know that biopsies do not always have to be performed to establish a diagnosis of liver cancer. And many liver cancers can actually be diagnosed with radiologic tests without the need for a biopsy. And so that's just one important thing to kind of keep in mind. One main take-home message is that if you are at higher risk for liver cancer, being seen by a specialist that focuses on the liver is really important. These doctors and nurses and advanced practice providers are called hepatologists, and being seen by these doctors can routinely can actually help prevent cancer or at least detect cancer at an early stage. Because if you detect cancer at an early stage, that's where it's more likely to be cured with surgery. And in some cases for liver cancer, we do liver transplants with the intention, again, to get rid of the cancer in its entirety and then live cancer-free. Thank you.